My name is Dr. Ali-Jones, a breast cancer surgeon here at the Torrance Memorial Hunt Cancer Institute. When newly diagnosed, patients receive a lot of information and it can feel overwhelming. In this video, I am going to provide you with information about mastectomy surgery. There are many reasons that a woman may undergo mastectomy. Depending on the size of the breast cancer and the size of the breast, the patient may not be a good candidate for lumpectomy. Some patients will choose a mastectomy for personal reasons, and some patients will undergo bilateral or double mastectomy due to a genetic mutation that increases their risk for breast cancer in the future. Women undergoing mastectomy will have the option of reconstruction by a plastic surgeon who will make a new breast with either an implant or using the patient's own tissue. This may be done at the same time as the mastectomy, referred to as immediate reconstruction, or it may be done at a later date. If the patient is not having breast reconstruction, the procedure is called a simple mastectomy. When mastectomy is performed without reconstruction, it is done with an elliptical or eye-shaped incision around the nipple, removing the nipple and the excess skin around it. This results in a horizontal scar. The patient may choose to use a breast prosthesis after recovery from this surgery. A drain is left to prevent any fluid from collecting under the skin. The drain usually stays in for about 1 to 2 weeks and is removed in the office. We'll talk more about drains and drain management in a different video. If a patient is having breast reconstruction at the time of the mastectomy, the skin over the breast can be saved and sometimes the nipple as well, depending on the type and location of the cancer. This allows the plastic surgeon to use the patient's own breast skin to reconstruct the breast. In a skin-sparing mastectomy with removal of the nipple, a circular incision is made around the nipple and the surgeon then dissects the breast tissue from under the skin, removing all of the breast tissue through this small incision. The lymph nodes can also be removed through the same incision. The plastic surgeon will then perform the reconstruction through this incision as well. In a nipple and skin-sparing mastectomy, the nipple is also saved. The breast surgeon will work with the plastic surgeon through an incision that will give the patient the best cosmetic result. The most common incisions used are a horizontal incision on the side of the breast or an incision that can be hidden in the crease under the bottom of the breast. If a patient is having reconstruction, the recovery depends on the type of reconstruction the plastic surgeon is performing. For patients that choose mastectomy without reconstruction, this is actually an outpatient surgery, so the patient can go home the same day and there is fortunately very little pain. We hope this information was helpful. At the Hunt Cancer Institute, our mission is to provide personalized patient care to support our patients and their families throughout their journey. We encourage you to visit our website at torrancememorial.org/breastcancer for additional information, or contact our Cancer Resource Center at 310-517-7077 to speak with one of the members of our care team.